Hello, I'm Tricia Sumich from ECA WA, and I'd like to introduce Ken Rogers. Ken will be talking to us about anxiety.
Yeah, thanks, Tricia. Hi, everyone. Good to see you again. I hope you're enjoying this short series of presentations, and I hope they're helpful. So, yeah, anxiety will be the topic that I'll share with you today. And I'll just get the presentation up as we chat. Okay. Even putting it up can often get me a bit anxious as well. So there you go. So what we'll talk about now is anxiety and post-traumatic stress disorder, which is a form of anxiety. Anxiety is that feeling of just being worried about stuff's going to happen, and being worried about being worried can often be incredibly debilitating. It's that dread that comes with the perception that something bad might happen. It might not. Look, we all feel anxious from time to time, but when that anxiety becomes really intense, it can be acutely crippling for those that and impacts on our ability to do things or enjoy life or feel safe in the world. It's the most common mental health condition in Australia. On average, 1 in 4 people, 1 in 3 women and 1 in 5 men will experience anxiety at some stage of their life. So it's incredibly common. And over a 12-month period, over 2 million people experience anxiety. And again, these stats are pre-COVID, so I'll be interested to see what the stats are like as we're coming through the COVID episode right now. I'm sure that's impacted massively on how people are feeling anxious about their own personal circumstances. So some of the symptoms of anxiety. So we've heard of panic attacks. So it's being worried that something really bad can happen, but the impact physically is often akin to how people feel like having a heart attack as well. Have hot and cold flushes, racing heart, tightening of chest, quick breathing, restlessness, feeling edgy, wound up, or edgy. Some of the psychological symptoms: excessive fear, worry, catastrophizing, obsessive thinking, and behaviour from anxiety is actually avoiding things that make you anxious, which is probably the worst thing that you can do. And exposure therapy, which we'll talk about shortly, can be helpful in terms of that. But behaviour, anxiety impacts on our study, our work life, our social life, and can permeate right across our lives. So some of the warning signs of anxiety: sort of feeling edgy or wound up most of the time, feeling constantly worried about a lot of things, feeling irritable, getting tense or nervous, avoiding people or social situations, trembling, tingling, lightheadedness, dizzy spells, sweating, urinating frequently, diarrhea can happen, getting really panicky, sleeping badly, having difficulty relaxing, getting worried you're going to make a fool of yourself, using alcohol and drugs to calm down and get to sleep, worrying a lot about yourself, having a fear of dying or going mad, having something bad happen, having thoughts that are hard to control, being worried about being in a place you can't get out of or that you can't get out of without being embarrassed. Even fear of germs or infection can be a worrying sign. Compulsively checking, counting or cleaning things, headaches, neck aches, chest pain, joint pain, nausea, tiredness, fatigue, fear of having a serious illness. There's a lot of warning signs that perhaps anxiety may be entering. So again, it's a fight and flight response, our amygdala, origin in our past, which would support us to protect us from the enemy or dangerous situations. And our body is evolved to help us survive, providing these quick bursts of energy to either run away or fight. So our fight and flight response, our amygdala, is also impacted when we start to become anxious. So what are some of the causes? Substance use can actually cause anxiety. A family history of mental health conditions can also be impactful. Ongoing stressful events like a work stress or change in living arrangements or family problems. Some personality factors: being a perfectionist or being a bit timid, lacking self-esteem. Having some physical health problems can also be a cause of anxiety, and other mental health conditions as well. So there's a lot there that can impact on us. There's a whole bunch of different types of anxiety as well. There's generalised anxiety disorder or social anxiety, fear of being in public places, specific phobias, panic disorders where you start to have panic attacks and start to panic about having a panic attack, so it becomes a disorder. OCD, obsessive compulsive disorder, you may have heard of in the past, and post-traumatic stress disorder, which I'll go into in a little bit later on in this short session. So in terms of Australians, from 16 to 85, 11% of males, 80% of females, and in total, 14% of Australians' population is impacted by anxiety in any 1 year. Now, PTSD, post-traumatic stress disorder, is a specific set of reactions that can happen once people have been through a traumatic event which threatens their lives or the safety of those around them. Now, importantly, that person has to consider that event traumatic, okay? And there's no, it's the impact that one person feels from that. It's no one size fits all, particularly in terms of trauma. So somebody might witness a car accident and accept it for what it is, and certainly it's very traumatic, but they may not have the same post-traumatic stress disorder problems as somebody else might have it. So as I say, it's very independent. So it can be, as I say, a car accident, serious physical or sexual assault, war or torture or disasters, bushfires that we've experienced in Australia, of course, floods, COVID. As a result, the person starts to feel intense fear, helplessness and horror, and the symptoms can often include difficulty relaxing or upsetting dreams or flashbacks of the event, and actually avoiding anything related to the event. So PTSD becomes diagnosed when someone has those symptoms for at least a month, and importantly, go and see your medical professional, your GP, in terms of discussing those issues as they are becoming apparent. So post-traumatic stress has four main types of difficulties. So people can start to relive the traumatic event through unwanted memory recurrence, often with vivid nightmares, intense emotional, physical reactions, sweating, heart palpitations, panicking, being overly alert or wound up, experiencing sleeping difficulties, irritability, lack of concentration, getting always on the lookout for danger. Try to avoid reminders, so maybe even avoiding activities, the places, the people, the thoughts associated with that event. So if they've witnessed a car accident, avoiding that particular section of road. And also they can start to become emotionally numb, losing interest in day-to-day activities, feeling cut off and detached from friends and family, and again, feeling emotionally flat or numb. So PTSD has an impact big time on people. So in terms of anxiety, what can you do? Again, there's a lot that you can do. GP, psychological support groups, acupuncture, mindfulness. I've got some other things up there. E-therapies are really helpful as well. And lifestyle choices particularly. Watch what you drink, how you exercise, what you eat, and the caffeine intake as well. So psychological treatments are often really important. Talking therapies, they can help you change the way that you think, so you're able to keep your anxiety under control and reduce some of those irrational worries. And there's quite a lot of effective psychological treatments for anxiety, which include acceptance commitment therapy, cognitive behaviour therapy, CBT. Behaviour therapy is trying to help people in terms of their behaviour. E-therapies, I've talked about. Exposure therapy. Like if you're scared of snakes, for example, some of that process is you start to see photos of snakes, not actually see the snake itself, become more and more exposed to that which is making you anxious. GPs can often prescribe antidepressant medication for anxiety, and again, psychiatrists, specialists prescribe medication for particular mental health problems, again, supporting in anxiety. So some strategies in terms of anxiety management can include slow breathing to 4, breathe out to 4, those sorts of things. Progressive muscle relaxation, lying on a bed, imagining your toes start to relax and your feet, and then progressively up your body. Trying to stay in the present moment is really helpful as well. Maintaining a healthy lifestyle is critical. And small acts of bravery can often be really helpful too. Challenge what you're saying to yourself. Your biggest critic is yourself. So challenge yourself to plan some time to worry and compartmentalise it. So write down your worries. Get to know what your anxiety is. Learn from others, but importantly, really be kind to yourself. Socratic questioning can be helpful too. Describe what you're worried about. What do you think how this fear might happen? The likelihood it will happen. What evidence supports your worrying thoughts? What evidence doesn't support these worrying thoughts? And if it did happen, what would you do? Realistically, what's the worst that can happen? What's the best that can happen? What's the most likely to happen? Are there any useful actions you can do about it now? What would you tell a friend who is in your situation? Putting yourself in the third party can be helpful, and realistically then re-rate the likelihood that your fears will be realised. Again, tick the box, and some of this stuff is often really helpful. Some structured problem solving, single out the problem that's worrying you and write it down. Work out what options you have available to solve that problem and write them down as well. Look at the pros and cons of each option. Consider what resources you've got and how you're going to do it. Choose the best option, list the steps, carry out the plan. Structured problem solving, applying logic can be really helpful. And relaxation techniques, progressive muscle relaxation, which I mentioned a bit earlier. Some breathing exercises, in for 4, hold for 7, out for 8. Calming visual imagery, imagining, and doing some, Japanese have a term called forest bathing, where they just go and enter a forest and enjoy the ambience and the scenery. It can often be really helpful. And meditation is certainly really important. So whatever works for you is really important in terms of relaxing. I'd like to thank you for listening to this. Again, it's a very short intro, but if you do have any concerns with anxiety, please go and see a GP and have a chat about it. Important to try and nip it in the bud where you can. So again, thanks so much for listening, and we'll see you next time.